With over 120 workers at the University Hospital of the West Indies out sick with COVID-19, there is a suggestion that asymptomatic medical staff can return to work. But is it really safe? Shamela Pullen has been speaking with UHWI's Medical Chief of Staff, Dr. Carl Bruce, and now reports.
Just days after the Ministry of Health confirmed that the country is experiencing a fourth wave in COVID-19, hospitals across the country are already coming under severe pressure. It's not just with patient load. At the University Hospital of the West Indies, UHWI, Medical Chief of Staff Dr. Carl Bruce says at least 20% of staff members are out due to the virus.
Already, without today's numbers, we're already over 120. And by the end of the day, when we get the testing result, we may be somewhere between 140 to 150 healthcare workers positive.
He, however, believes the infected workers can add value to the health system. Dr. Bruce is proposing that asymptomatic healthcare staff can return to work in what he describes as COVID spaces. It's a suggestion he intends to discuss with the Ministry of Health.
So there are medical ICU ward 7, the field hospital, where we have COVID positive patients. Some of the physicians and workers who are well, even though they have tested positive because of exposure, have said, look, if the system comes under that much stress, we are willing to work in those areas because we know we have to be in quarantine. And the last thing we're going to ask the ministry and the EOC to do is to look at the quarantine period. We have discussed it with occupational health, infectious diseases, and infection prevention and control. And what they're suggesting is that we have to look at maybe a quarantine of maybe 7 or 8 days and a test. And if that test is negative, then those workers can come back in to help the situation.
The UHWI is one of several COVID testing sites. According to Dr. Bruce, prior to the Christmas period, there were at times 0 positive cases. That has since changed.
We have 16 patients on Ward 7, 24 patients at the field hospital. In the holding area, that is the isolation area, we have about 10 patients who are waiting for their COVID results. So if those results are positive, that adds to the pool, or we can de-escalate them and put them in another area. So the latitude we had, the flexibility we had, where we could take out some non-COVID beds and put it for COVID admissions. We don't have that because of the large number of patients with the chronic non-communicable diseases who were admitted without COVID over the holiday.
Meanwhile, Dr. Bruce is imploring Jamaicans to take the COVID-19 vaccine as it is one of the safest ways to prevent hospitalizations. Shamela Pullen, TVJ News.
And Health Minister Dr. Christopher Tufton says the government will not be looking at that suggestion at this time, while at least one public health expert believes workers must be tested before being allowed to return to work. Anthony Lugg has the details.
It's a little premature, in my opinion, because we have not really confirmed that Omicron is here.
Public health specialist Dr. Alverston Bailey responding to the suggestion that asymptomatic medical staff be allowed to return to work in COVID spaces. The suggestion comes as scores of medical personnel are in isolation, having tested positive for COVID-19, placing added pressure on the public health facilities. We put the issue to Health Minister Dr. Christopher Tufton.
I would not recommend it, but I will take advice on it. But I immediately see some challenges with that.
Dr. Tufton says while the virus will affect individuals differently, caregivers can't be compromised as this could affect their ability to care for patients.
On the face of it, I can see why it would be suggested. But when you drill down and look at some of the nuances and the technicalities of just caring for a patient, you don't want a patient, albeit a nurse at the time, or a doctor, to be caring for another patient because it could possibly mean that the care and the quality of the care could be compromised.
With the rapid spread of the virus in the U.S., some health facilities have been using asymptomatic workers. The Boston Globe this week reported that the Alena State Hospital and a private nursing home in Rhode Island have taken this route due to staff shortages, But for Dr. Bailey, it boils down to one thing.
You have to do a lateral flow test first to ensure that you are not spreading the virus, because the lateral flow test is a marker of transmission. And therefore, if you're asymptomatic, then a lateral flow test must be done. And if it is negative, then you can return to work fairly quickly. But you should not return to work until the flow test is done.
Anthony Lugg, TVJ News.